So without further ado, we will start the webinar with Dr. Mayada Al-Khaqani, the founder of the group and the chair of the advisory committee. She will introduce you to our special interest group, our goal, and our mission. Dr. Mayada, the floor is all yours.
Thank you so much, Van. First of all, good morning, maybe good afternoon and good evening to everyone. Thank you for allocating time to join this webinar. It's our first webinar. We are really honored to have you in our webinar. Let me just say a few words about myself. My name is Mayada Al-Khaqani. I'm a Boehringer Ingelheim full-time employee, and also I am chair and the founder of the patient engagement group in international under the umbrella of International Society of Pharmacovigilance. And also I am the co-founder and ex-president of Middle East chapter. I want to declare that I don't have conflict of interest. All the views in this webinar will represent my views, nothing related to Boehringer or to the International Society of Pharmacovigilance. Before I'm gonna talk about the group and the vision of and the mission of the group, I would like to say a few words about I will say one of the advisory committee member that we lost him just a few weeks ago. He's a mentor, he's a friend, he's a pioneer, and he's the legend of the pharmacovigilance. Sten Olsen, I attended his funeral yesterday at Uppsala with other colleagues from the WHO and the Uppsala Monitoring Center, and also from the International Society of Pharmacovigilance. Words cannot express our sadness to lose our dearest colleague. Sten, if I want to talk about Sten, I believe I will need days and weeks in order to represent him very well and represent his legacy and what he did to the pharmacovigilance. He joined actually the Uppsala Monitoring Center in 1978 after they offered him to be in the center, and he dedicated his life to serve the center and also to contribute in the development of the pharmacovigilance across the globe. He was the past president of the ISoP, the International Society of Pharmacovigilance. According to his records, he had 91 publications, and he had many projects. All these projects completed by him and his team. Sten, he left a big legacy, full of science, full of ethics, full of nice memories in the heart and mind of each one who worked with him. Rest in peace, Sten. We will miss you for sure, but I'm sure your soul and spirit will stay with us forever. So to talk about this group, how we started actually, when we start to think about the patient engagement, we were trying to strengthen the involvement of the patient in the treatment journey, from the development of the drug till the delivery of medication, but also from the pre-diagnosis till the patient will be able to receive the treatment. Patient will go through many phases and many challenges, and we know that. Previously, the involvement of patient was not really strong and weak. Most of the organization and industries were focusing on how to ensure that the patient will be able to access the medicine. So there was no active listening, and there was no understanding about the challenges, about the barriers, and also the need of the patient. In recent years, where everyone start to realize there is a big demand and need to involve the patient, and there is a need to actively listening to the patient and understanding their challenges and how we can work with them closely in order to overcome these challenges. And this is the reason why we found there is a big need to establish this group under the umbrella of International Society of Pharmacovigilance. When we submitted the proposal, got well accepted and supported by the leadership of the society. And then we start to establish the committee in order to drive the vision and mission of this group and also the plan and the strategy. We decided, all of us as the committee or advisory committee members, together we come up with one vision, which is enhance the core role of the patient in medication safety. And how we can achieve this vision through the mission that also all of us together we decided to develop for this group, which is help shape the future of the patient in the medication or in the therapeutic decision making, safety surveillance and safe use of the medicine, and also foster the appreciation of the patient contribution in the medication safety, and also enhance the patient knowledge network, and also an independent representation of the patient involvement in the medication safety. And lastly, we were focusing also on the involvement of patient in the development of policies and guidelines in order in the medication safety. So as you can see, we focus on the involvement of patient from different perspectives. But for sure, we prioritize and we decided to focus more on the low and middle income countries because we found there is a big need for these countries. I won't talk a lot because I have my colleagues here in the webinar who are gonna share with all of you their perspectives and how we're gonna drive this group forward successfully to strengthen the involvement of the patient in medication safety. Now I will hand over to the co-chair of the group, Dr. Manal, in order to introduce the advisory committee members. Dr. Manal, the floor is yours.
Thank you so much, Dr. Mayada, and so glad to have all of our colleagues from all over the world with us today in our first patient engagement SIG webinar. My name is Manal Mohammed Yunus, and I am the co-chair of this special interest group. Also, I work as a full employee of the Ministry of Health of Iraq as the head of Iraqi Pharmacovigilance Center. I'm also the vice president of the Middle East chapter of the ISoP. Also, I'm a member in another SIG, professional qualification SIG of the ISoP, advisory board member of the ISoP also. So, starting with our colleagues that were kind, they were so kind to accept our invitation to join our committee, alphabetically with Angela Caro. She's pharmacist, epidemiologist, holding 2 masters, one in pharmaceutical care and another in education, with 19 years of experiences in patient safety, medication use, medical device safety. She is a speaker, teacher, consultant in the same topics and the human factors, including leadership, communication, teamwork, empathy also. research. She has also interest in research in cognitive ergonomics and education safety. She is a member in the Research Ethics Committee and the founding member and the president. Please mute yourself. Can you please mute our attendees? Thank you. So, Dr. Angela is a member of the Research Ethics Committee, founding member and the president of the Colombian Association of Pharmacovigilance, and a board advisory board member of the International Society of Pharmacovigilance. She's the ISoP Special Interest Group Coordinator, and she's also ISoP Special Interest Group Medication Errors Co-Chair, ISoP SIG Risk Communication Member, and a founding member of the Latin American Network of Human Factors and Ergonomics in Healthcare Systems. Currently, she's the Pharmacy Career Director of the Potencia, I don't know how to pronounce it, sorry for that, Angela, Universidad Javerni. Maybe you can do that later on.
Thank you so much, Manuel. Thank you so much. Thanks for this support. Now, all the time happen the same. The problem with the communication, because we are in different parts of the world, and this is interesting. It's one of these things that I want to talk about the patients. The university is Pontificia Universidad Javeriana, and is the university that university I am the pharmacy career director. Thank you so much for your introduction.
Thank you. Now, the second one I would like to introduce is Helen Haskell, and she's the president of the American Patient Organization's Mother Against Medical Errors and Consumers Advancing Patient Safety. She's an Institute of Healthcare Improvement Senior Fellow and a co-chair of the WHO Patients for Patient Safety Ad Hoc Advisory Group. Helen has written and co-authored numerous articles, book chapters, and educational materials on patient engagement and safety, including a co-edited textbook on case studies from the patient perspective. Helen holds a bachelor degree in classic studies from Duke University and a master's degree in anthropology from the Rice University in the USA. The other one that I would like to introduce, although she's not with us today for some business reasons, she's Helen Nadagi. She's a pharmacist and a clinical epidemiologist and the director of the product safety at the National Drug Authority in Uganda. She's the president of the African chapter of the ISoP. She holds Master in Business Administration and a PhD in Public Health. She also has been vice chairperson of the African Vaccine Regulators Forum, a network that has seen the regulatory system for clinical trials of medicines and vaccines uplifted in the last 10 years. Linda Hallmark, she's with us today. Thank you, Linda, for being with us. She studied pharmacy at the University of Uppsala, Sweden, and after graduation, she relocated to the Netherlands, where she joined the Netherlands Pharmacovigilance Center, the LARIB, in 2004. She's currently the deputy director. She has experience in all aspects concerning the reporting of AD adverse reactions, ranging from creating awareness of reporting to designing individual case safety databases and everything in between, as she's written here. She is and has been the LARB lead participants in national and international projects such as IMI, Web Radar and Conception Project, and the EDCTP PAVIA project. Her main research area is patient involvement in pharmacovigilance and the use of web-based intensive monitoring to gather information about adverse reactions. She has published more than 25 peer-reviewed peers. I know that she don't like, I remember that once you said that you don't like reviewing, but you like writing papers. So all in the field of pharmacovigilance. She is also a member of the CIOMS Working Group 11, Patient Involvement in the Development, Regulation, and Safe Use of Medicines. Coming to our next member, Priya Bahari, she is well known to the all pharmacovigilance, all people who are working pharmacovigilance. She's working with the EMA, with the European Medicine Agency since I think 2004, something like that. She is the pharmacovigilance lead, guidelines and risk communication at the EMA. She completed studies in pharmacy and epidemiology, as well as PhD in quality management of healthcare. She holds certificates in strategic health communication and global health diplomacy. She is associated research at the Utrecht University and an active member in 2 ISoP special interest group, chairing the risk communication special interest group and a member in our patient engagement special interest group. She's a member of the International Society also of Pharmacoepidemiology. She's an editor of the book Communicating About Risk and Safe Use of Medicines, published by in 2020, not that far. I think I have come to end my introduction to our colleagues, and I would like to ask all attendees to kindly put their questions in the chat box, and we will surely locate enough time to answer them. So with that, I would like to over to you, Ban. Thank you.
Dr. Manal. Thank you. So now we will move on to the next part where we will ask the committee regarding the patient engagement. As you probably already know, the use of the term patient engagement has greatly increased in the recent years when compared to other terms, and it will even increase more in the future. The importance and pivotal role of patient engagement have been well recognized and increasingly growing. It is a promising avenue in the area of healthcare education, and there is growing policy support to engage patients as partners in their healthcare. So, since we have a diverse committee with us today, we would like to get some insight from each advisory committee member from their perspective, from their point of view. So we'll start with Dr. Angela. We would like to ask you, how do you see patient engagement from your perspective? The floor is yours.
Do you hear me?
Yes.
Okay, thank you. Now, thank you so much, Ben, for the question. I just want to share about my vision of engagement, and my intention is to show how we are just a support and the patient is the leader. I feel that sometimes we try to have all the protagonism. We try to consider the health system works because we as a healthcare workers are inside in. But my vision is everyone is the leader of his health, of her health. Then if we help to the patients to understand that they are the leaders, they are the person who is responsible about their health, we could just support them with some information for them. They could take decisions, and additionally, we could help them with information, with our opinion, with our information, or the way that we see the different fields. But finally, the patient is to take the decision. The patient is the person who decided what is the best for my life. And sometimes we just consider that we have all the truth. We are the person who could decide over the patient. We are, I feel, I am talking about pharmacists, physicians, nurses, etc. And we consider the point of view of the patient because maybe it's important the point of view of the patient. For me, that's not the way. The way is we must to understand what the patient wants, what the patient feels, and then we could support them. And of course, about communication is the other big topic with them. If we could have this easy communication with them, we could inform in the best way possibilities of treatments, possibilities of attention or care. Maybe they understand better what we are doing. And we couldn't consider that we are over them in any knowledge. The knowledge of the patient is the most important because it's their life. And no, we couldn't decide in other way that they consider. That's my point of view. Thank you, Van.
Thank you, Adla. Thank you for this great perspective and insight. Now we will forward the same question to Helen. You can start.
Thank you so much, Van. Well, I have been a patient advocate for many years, and my mission has always been patient engagement and patient safety. There's a recent report out that that says that medication harm lies at the basis of half or more of all patient harm in the world. That's what I have been hearing from patients. A big part of our mission is support of patients. I've interviewed and surveyed, thousands of patients at this point because I've been doing this for so long. And what I see is that patients observe very different things from healthcare providers. And in my opinion, the patients are usually right. Because they have a bigger perspective. They're seeing their entire patient journey and not just a small part of it. Medicine is very specialized, patients are not. So one of the things that I've seen, I came to this because my 15-year-old son died of an overdose of NSAID pain medications in a hospital about 20 years ago in an American hospital. And when I started looking into it, one of the things that was immediately apparent to me was that his providers were really not familiar with the medications they were prescribing and using. And of course, that's also true of patients. And when I talk to patients, what I find is often there is a medication reaction, and it may be very minor, that lies at the root of big harm events. What happens is there is a cascade of errors and overtreatment that are precipitated by this medication reaction because people don't understand what it is. And in all of the events that follow, the initial medication reaction gets lost. So one of the things that I want to do is to try to tap the wisdom of patients, to really talk to people on the ground in different countries around the world, because the problems are very different in different places. Find out what their needs are, what their issues are, where the harm lies, and use that to try to get people to be more cautious, both patients and providers, in the use of medications. I'll stop there.
Thank you. Thank you for leading this noble cause and sharing your unique perspective with us. Thank you. Now we will share the same question with Dr. Mayada. If you may start answering.
Maybe we'll direct it to Linda first, and then
as you like, of course.
Linda,
the floor is yours.
Okay, so thank you. When I started at LARB in 2004, which is quite a long time, we were just introducing patient reporting. So for me, bringing in the patient perspective has always been there. But in the last few years, we have seen an increase in the engagement with patients. And I think it's a very natural development because the main aim of pharmacovigilance is to reduce harm, and the harm is experienced by patients. So it's very important for me to know what patients need in order to reduce harm, for example, to recognize harm or to avoid harm, for example, in prescribing, but also what do they do when they experience harm? Who do they go to? How can you treat harm? And I think patients are excellent in telling us that. So I think it's important, the engagement, but also that it is a sort of a two-way communication, not only that we listen to them, but also that we try to provide the services or the information that they would need in order to optimize their medicine use. So for me, that's very important in this engagement, as this sort of two-way communication, and not only that is sort of flashy and popular way, because it's now very into have patient engagement, but you really also as an organization where you commit to patient engagement, you also commit to do something for the patients. I think that's very important for me.
Thank you, Linda, for your amazing answer. Now, although they could not join us today, but they already sent us videos sharing their perspective regarding patient engagement. So, Jean-Christophe, would you please share the videos that Helen Nadagi
Hello,
sent
my
us?
name is Dr. Helen Biomrenda, a pharmacist by training and one who's really interested in patient engagement matters, and that's why I'm part of this ISoP, Patient Engagement Special Interest Group. Indeed, as part of my work at the regulatory authority, I have come to learn and engage with patients more frequently in different fora with different stakeholders. As earlier on, I engage with patients in the community as part of my research, and I found that patients prefer different means of being reached compared to healthcare professionals. They prefer, in fact, radio messages, and healthcare providers, especially in the rural areas, may think that it's easier for the patients to come back for messages on drug safety to hear from them at the facility, or to get messages from meetings that they would have in the community about discussing about patient safety in dialogue form. So I have learned that patients are important, and they're a very important voice and important factor. Hello, my name is Dr. Helen Biomrenda.
Okay, thank you, Jean-Christophe. Now we will move on to Dr. Mayada, if you would like to answer the same question. Thank you.
Thank you, Ban, and thank you for everyone. I will talk from a pharmaceutical perspective. I believe previously the interaction between pharma industry and we have a Priya with us. Welcome, Priya, to the webinar. Happy to see you. The interaction between the pharma industry and patient was very limited, very restricted, I will say, by many regulations and requirements, where did not give the chance to the patient to share their challenges, their needs with the pharma industry. Now, these days, I will say, or nowadays, I think it's much more much more, I will say, in a better situation, because we are getting the opportunity to understand how we can help them, to manage their disease, how we can help them to manage their adverse events, because the involvement of the patient is not from the pre-diagnosis to the drug development to the receiving the treatment, but also post the treatment. They will need a lot of guidance, a lot of education, involving of the patient in the packaging of the medication as well, and in the clinical trial design. Let them, share their perspective, what they want, what they expected from the pharma industry, how they want their medication. What kind of administration, the storage condition, everything, involving of the patient, because again, all of us, what we are trying to do, we are trying to find the optimal solution for their disease. It could be through the medication, and now with the digital involvement, it could be through digital involvement as well. So try to, as I said, listening carefully, because I believe this is very important, to listen to the patient carefully, and put ourselves in the position of the patient, you know. Most of us, we said we are patients. It's true, we are patients. Our relatives are patients. Our families are patients. And this is the reason now when I am talking to the patient, I try to actually put myself in the patient position and see how I am going to think, what I want actually, what I am expecting, you know, from the healthcare system, from pharmaceutical industry, from the health authority, from the organizations around the world. How I want them to support me. You know, this is what we need to do each time we are talking to the patient. Again, on the top of this one, if we're going to help the patient to achieve what they want to achieve, for sure we're going to help them to adhere to the medication. We're going to help them to reduce the impact of the adverse event by well educating them how to accept and how to manage rather than to avoid, because there is no safe medicine in this world. This is the fact. But it's very important to understand how to manage all these adverse events. And in return, what we are also trying to help the healthcare system by reducing the cost burden, you know, on the healthcare system. Because if we educating the patient how to manage their disease, how to manage their treatment, how to manage their adverse event, how to have a safe care, then at the end, we are trying to reduce the number of hospitalizations, unnecessary clinic visits, you know, so which at the end, we are trying to help the healthcare system as well. So this is how I am seeing it from pharmaceutical industry. Thank you, Ban.
Thank you, Dr. Mayada, for this thorough comment and deep perspective from your side. Thank you so much. Now we will forward the question to Priya. Thank you so much for joining us. First of all, we heard it's been difficult to make the time through your schedule to be with us today. So thank you so much for being with us. Thank you, Priya.
That's very kind indeed. I was jumping in a little bit. There is a video, so yeah, please use the video. That's nice.
We'll
Thank
play
you.
your video. Thank you so much.
Hello, I'm Priya Bari and I speak to the Special Interest Group for Patient Engagement of ISoP. And I'm just leaving you a short message about who I am and why I think this Special Interest Group is important. I'm a pharmacist and epidemiologist working at the EMA, the European Medicines Agency, and I have been active in ISoP since 2002. And I'm a member since 2003. I'm also the coordinator of the Special Interest Group on Risk Communication. I believe that we have to make the patient, who is the center of our activities, also part of our activities. That is the future of successful pharmacovigilance. And we need to offer something for the patients as much as we need to learn how to interact. It's not about reaching out only, but also embracing, learning to listen, understand, develop a common vocabulary, develop a modus of interaction, of dialogue, in whichever setting that can happen. That can be in the clinic, in the surgery, in the hospital, in the pharmacy, in the regulatory environment, in consultations for industry. Whatever the setting is, we need to enhance this collaboration so that medicines can be used safely and confidently by patients. Thank you, and I wish good luck to our group. In fact, I need to add a few more things because I would like to share with you that at EMA I'm actually very involved in patient engagement. I was part of the preparations of patient engagement in the area of pharmacovigilance around between 1999 and 2003. I then welcomed in a pilot project patient representatives to the Pharmacovigilance Working Party, which at this time I was the secretary, and we piloted how patients can actually work in committees and advice committees and contribute to committees in the area of pharmacovigilance. We then at EMA installed specific working parties for patient and also healthcare professionals, and I represent our pharmacovigilance office in these groups. And the latest development is that I'm in charge of creating a framework for strengthening the collaboration of our Pharmacovigilance Risk Assessment Committee, the PRAC, and stakeholders, patients and healthcare professional stakeholders in the area of risk minimization measures. So yeah, I'm really active in the area, and I hope I can add my experience to the group as much as learn from you all and make the work also globally relevant. Thank you.
Thank you, Preya. Thank you. It's an honor to have you here with us. And now, at last but not least, we will ask Manal Yunus to share your perspective regarding patient engagement. Go ahead.
Thank you so much, Ban, and thanks to all our colleagues at the committee for their very much, I don't know, I like every word they said. Well, I think that we need to have, that the right mindset that accepts patients to be part of the healthcare system and decision-making process, because this will, that benefit not only in reducing the cost of the services but also improve the healthcare outcomes and build the trust and better patient care, leading to what we all are looking for, healthier patients. So we know that the more the healthcare and the regulatory system being developed, is the easier it becomes to engage patients and enhance the trust between all of the parties. So how we are going to improve this health services? I think it's by learning from patients' experiences, and this is very important. And patient engagement should not be a privilege. It should be an essential part of the healthcare system design itself. And patient engagement, with all of these things in mind, means that patients to play an important role, not in anything else but their well-being themselves. So this is what I have in mind regarding my perspective. And over to you, Man. Thank you.
Thank you, Manal. Now we hope we're not running out of time. We still got some time to answer your questions. So we will start with the first one by Manoj Swaminathan. Just curious to know if the term consumer engagement may be better than patient engagement, as we have a wider audience. Example, in case of pediatric safety, the parent caretaker may have a bigger role as opposed to the patient. So if you would like to comment on that, anyone from the committee?
Well, this is Helen. I will comment on that.
Thank you.
So usually we talk about patient and family engagement, and perhaps we should include that in our, in our statements and in our titling. We use the word patient to subsume the concept of family, and we use the word family to subsume the concept of friends and caretakers. So patient is really sort of a shorthand, but I think that it's not, you can say consumer. I think that's sort of a different way of saying patients, looking at different aspect. But, but the family is the issue, the people who surround them, their support system.
Thank you, Helen. Thank you.
I just want to add one thing actually about the consumer. I believe if I am a patient and you ask me which word is more close to me, I will say patient, because there is a very nice quote to Nelson Mandela, which I like it, and it's a standard in my life, even on a professional level. He said, when you talk to a man in a language he understands, it will go to his mind or his head, actually. But when you talk to a man in his language, it will go to his heart. And I believe when we talk to the patient and we call them patient, it will go to their hearts more than consumer. Because even for me, if I am a patient and you call me consumer, I don't know how I am going to, take it, or how it will look like, to me as a patient. So I believe still we are more into patient rather than consumer. This is in my opinion, but I fully agree with Helen that we need to actually also to take in consideration their families, the caregivers who are still, I don't like caregiver, I like love giver, because they are giving love more than care, So this is how I am from my perspective, but yeah.
Thank you, Dr. Mayada. Thank you for your beautiful insight. Now we also have Muhammad El-Hawari. He shared his point of view. He thinks we need to discuss more how to make doctors accept to hand over some power to patients, because we were not taught to involve patients, and they are hesitant to renounce the paternalistic model of healthcare. Yes, Dr. Manal?
Yeah, maybe I can take this question. I totally agree that in our countries that this type of relationship is still the model, the accepted model of working with our patients and consumers, so that Manoj will be happy. But in fact, that I was thinking about it, and I think education is the the right way to target this kind of issue. We should educate not only the patient, we should educate the healthcare providers themselves, the regulators, the people who are working in the same area. And when we are saying education, we should start from the early school years. I mean that, because this will help a lot in building that I was saying, the mindset, building the mindset of the people about this kind of activities and of this kind of engagements. So that there is a lot big problem related to health literacy in our countries, and this is another problem that we need to address. That I was thinking, it's not only health literacy from the public perspective, but also health literacy from the people who are working in our the healthcare system itself. So that it's a multifactorial one problem, and we need to tackle each part of this so that we can have maybe we don't have to start from scratch, because many other people or countries or regulators have already done this. So we need only to digest what they have already done, and we can use what they have already done as background knowledge, or we can start our projects and in the long way of the patient engagement journey. So not only that, I think that collaborations and integration of between national and international patient organizations, NGOs, will offer great learning opportunities, like for example WHO, and this will add great value towards our goal also. I hope that I answered your question. Thank you so much, Mohammed.
Thank you, Mana. Before we move on, I think Linda wanted to share her point of view regarding the use of the word consumer. Would you like to share it with us?
In the chat. So I'm not a big fan of the word consumer, since it indicates that medicines is a commodity, and I think medicines are very special products which people will only take if they really need to. So they are not like consuming it for their own pleasure anyway. So I think for me that doesn't cover the special place that medicines has compared to other products on the market.
Yes, thank you. Also, I think Angela also wanted to answer this question.
Yes, now I think that we must consider the medicine like a tool in health public. I mean, it's the way that the people are recovering the health. It's not just like a product. Then I think it's if we really need to use this tool, it's great. But if not, if we could have other options like a better life, I don't know, the healthy habits, etc., it's better to use that. Then I think the medicines and all the control of the self-use of the patients and all the environment to do this very, very easy for them is the most important point of view. We need to consider them a person who has fears, who has feels, who has a life to keep on. Then I think the best way is the way that Linda is saying, is we are using some medicines because we need it, and I hope the people use low medicines, the low that they can. Then I'm sure the best way is to consider this like a tool and not more than that. Thank you.
Thank you, Angela. These are all really valid points, and we will now move on to conclude this webinar. But before we do so, I would like to ask you all to open your cameras so we can take a group picture, if that is possible. Yes, thank you. Okay, 1, 2, and now 3. Okay, thank you all for joining us in this webinar. We really hope you grasped as many information as you could regarding this important topic. And we would like to ask you to follow us on all of our social media accounts, the ISoP special interest group of patient engagement. We have an account in LinkedIn, Facebook, and Twitter. So we really wish you could follow us in all of these accounts, and we will keep you updated on all of our activities. And also, we are still accepting advocate application for the group. So if you would like to apply to be an advocate for the group and work with us in our activities in the future, we will gladly accept all your applications. So I hope we covered everything. Thank you so much to all of the advisory committee for making the time to share their perspective and their unique perspective, each one of them. And everyone who made the time through the weekend, if it is a weekend in your side, and joined us in this fruitful discussion, we hope. So thank you so much, and we will see you next time. Thank you.
Thank you all. Don't forget the survey to receive the...
Yes, you will receive the email within 48 hours, hopefully.
Thank you.
Thank you so much. Bye-bye.
Bye-bye.
Bye-bye. Thank you, Jean-Christophe. Thank you so much.
Thank you, everyone. Bye-bye.
It's too late at your end. Thank you so much for being with us. Thank you. Thank you, Helen, also. I know that it's too late.